Good morning, everyone. Thank you for joining us for this press conference. I'm Jackie Speier. I'm a Congresswoman representing San Francisco and San Mateo counties. And we are all gathered here today because there is a public health issue that must be addressed. Gummy bears, cotton candy, chocolate mint, thin mint are not flavors at a local ice cream shop. Instead, those are the flavors that you can get for e-cigarettes. And if you look over here, you'll see that there's a gummy bear flavor here. All of these e-cigarette holders are clearly aimed at not adults, but young people. The e-cigarette industry has also lured children and teenagers with aggressive marketing tactics that give them the impression if you use e-cigarettes, you're going to be sexy, or you're going to be glamorous, or you're going to be cool. A study from the American Academy of Pediatrics found that youth exposure to e-cigarettes TV ads has increased 256% just in the last 2 years. Young adults have seen an exposure by some 321%. And the truth is, all this advertising has worked. Usage of electronic cigarettes in middle and high school students has more than doubled in the last 2 years. Although the FDA recently proposed rules to partially regulate e-cigarettes, it will literally take years before they go into effect. Additionally, the guidelines do not go far enough. They don't address fundamental issues with this product, such as the lack of child-proof packaging, the regulation of flavorings that attract children, and the aggressive advertising to young people. In fact, the FDA regulations that are proposed for e-cigarettes are less than the FDA regulations for the manufacturing of dog food. That's why I'm introducing the Stop Selling and Marketing to Our Kids E-Cigarettes Act, known as the SMOKE Act. The SMOKE Act will extend the same FDA regulations of tobacco products to electronic cigarettes and also address the gaps in FDA proposed rulemaking. It will also regulate electronic cigars, cigarillos, pipes, and hookahs, and their e-liquids as well. This legislation will prohibit the sales to minors, prohibit the use of flavorings in electronic tobacco products, establish child-proof packaging standards, because just 1 teaspoon of e-liquid can kill a small child. Establish dosage limits to prevent harm from accidental ingestion or absorption, and establish concentration limits and labeling requirements for ingredients, including the additive and poisonous nicotine. E-cigarette poisoning has escalated in recent years, as this graph shows you. Between 2012 and 2013, the number of exposures went from 1.36 per month to 9.6 per month. But here's the worst of it. The majority of these cases were of children 5 years of age or younger. Finally, the SMOKE Act will restrict the marketing and advertising of electronic tobacco products through the FDA by applying the Federal Cigarette and Labeling Advertising Act. And it will also give the Federal Trade Commission the authority to prosecute the advertising, promotion, and marketing of electronic tobacco products and the e-liquids to children as unfair and deceptive practices. So this advertising is patently obvious. A bejeweled Hello Kitty doesn't appeal to 20-somethings. It appeals to tweeners. The e-cigarette industry has exploded, and the consuming public deserves to be protected, and to do so, the industry must be regulated. You know, here in San Francisco, we sometimes take for granted how far ahead we are of the rest of the country. We have done a lot locally, and I'm delighted to introduce to you Supervisor Eric Mar, who has done locally what I hope to do nationally. And that is, he has authored legislation that has passed here in San Francisco to treat e-cigarettes like regular cigarettes. Please welcome Eric Mar, Supervisor.
Thank you to Congresswoman Speier for the courage to stand up for our children and the public health. I was proud to support with our broad and grassroots tobacco-free coalition local efforts here to control e-cigarettes and to challenge big tobacco. We joined New York City and Chicago and Los Angeles and many other cities several weeks ago to implement our local policies, but it's not enough. And the Smoke Act that Congresswoman Speier and hopefully communities throughout the country will be supporting and passing will go a long way to challenge big tobacco and the e-cigarette industry. I wanted to also acknowledge that our grassroots tobacco-free coalition has the leadership of young people from Vietnamese Youth Development Center and the Youth Leadership Institute that have helped us develop much better policies in our city that have a voice of young people speaking for themselves and working on policy making with us in City Hall and hopefully in throughout the country as well. Also, I wanted to say, as Congresswoman Speier mentioned, that e-cigarettes as designed are very sneaky, and the industry knows that they're trying to get around a lot of local decades of work by Professor Stanton Glantz and UCSF and other researchers to limit tobacco marketing. So our efforts are really catching up with this sneaky industry. Big tobacco and the e-cigarette industry also have known that it's a wild west where they can market like crazy to young people, and we're going to work together not just locally here but throughout the country with the Congresswoman to pass the Smoke Act. Lastly, flavors like Skittles and gummy bears and other types of flavors are clearly not targeted at people my age or others, but it's about addicting and hooking and luring a new generation addicted to nicotine, which is a highly addictive substance that's very harmful to people. So thank you so much for being here, and I give tremendous props to Congresswoman Speier, but especially our grassroots coalition for standing up for kids and for the public health. Thank you.
So the preeminent researcher on tobacco in this country, the outspoken lone wolf for many, many years, is Dr. Stanton Glantz, and we're delighted that he's here today, the director of UCSF's Center for Tobacco Control Research and Education, to comment on e-cigarettes.
Well, I'm also here to endorse Congresswoman Speier's smoke bill. The FDA has proposed a regulation that would simply say we have jurisdiction to regulate e-cigarettes without actually doing any regulation. And the terms of this bill to include e-cigarettes in the broadcast ad ban, to put restrictions on nicotine deliveries, and to prohibit marketing to kids are something the FDA should have already been proposing in its proposed rule, and hopefully in light of suggestions in this law, the pressure from this law, and the kind of grassroots support that Supervisor Mar was talking about, they'll do it. As Congresswoman Speier said, use among kids is exploding with e-cigarettes. We recently published a paper and found that among kids who've experimented with regular cigarettes, if they also use e-cigarettes, they're about 8 times more likely to go on to establish smoking. That even among adults, while some adults have used e-cigarettes to quit, when you look at the population of all smokers, e-cigarette use actually depresses people. So it's tremendously important that there be effective regulation of these products and of this industry, and that the Obama administration stop waiting and start actually doing something to protect not only our kids, but everybody in society. Thank you.
Our next speaker is Dr. Robert Jackler, who co-founded, along with his wife Lori Jackler, the interdisciplinary research group entitled The Stanford Research into the Impact of Tobacco Advertising. Sarita. Dr. Jackler?
Thank you, Congresswoman Speier. You know, this week, the United States Senate held hearings and the chief executive officers of the two leading electronic cigarette companies in America, Blue and Enjoy, both adamantly deny that their brands market to children. Let's look at their ads, and you can judge for yourself whether or not they're telling the truth. Now, these are some, what we'd say, adult flavors. We see Bazooka bubblegum, gummy bear, chocolate, and of course my favorite, cotton candy. These are some additional adult flavors, this by the leading brand. We have peach schnapps, pina colada. You know, with that, and of course, electronic cigarette flavored beer, these are ways that teens can break two adult taboos at the same time, smoking and drinking. Now, did you ever wonder if teens were preoccupied with sex? Well, this upper corner, which we see there, is a 2014 Sports Illustrated. After the big tobacco company Lorillard took over the Blue brand. Do you notice where the Blue logo is? Do you see what it says? Slimmed, charged, and ready to go. I can't imagine what that means. Playboy. Blue uses Playboy Playmates to go to schools to market electronic cigarettes. Now, if you ever wonder how far Blue will go in exploiting sexual themes for youth, Google Blue, sex with robot, and Stanford. Now, teens are rebellious. Teens like to be individual and to break the rules. So as you see here, this older woman holding her middle finger up, who would you say would think this is cool? It's kind of like Nike. Just do it. Rebel. Be individualistic. You know, cartoons, they've been banned since the days of Joe Camel. Electronic games, which are aimed towards kids on social media. You throw the baby into the pool, and if you do it, you get a discount point to buy their electronic cigarette products online. You have different socials. Look at these. These are kids and kids-type activities that are there. TV and radio. This year and last year's Super Bowl had electronic cigarette advertisement. They pervade radio in the airwaves, but the heaviest marketing is in social media, web video. So who lives in the world of social media, after all?
What do they benefit?
Do teens have a lot of money? Of course not. So how do you lure them? You give them free samples. Now, you give them cookies along with the electronic cigarettes, or you have scantily clad girls and boys. So who do you think is going to want to get flavored nicotine products from someone giving them a gift like that? Now, it is truly remarkable that the images of doctors and nurses have returned to cigarette marketing in 2014 for the first time since the 1940s. Why, you can even buy vitamin-enriched electronic cigarettes, flavored Oreo cookies. Nutri-Cigs claim if you use their product that you will actually lose weight. And here we have the father of the year toasting his son's milk with beer while smoking an e-cigarette, as though the exhaled nicotine didn't represent a risk. And I will leave you, we're not going to hold that in. Thank you. I will leave you with images from the 6 United States electronic cigarette companies that advertise breast cancer pink e-cigarettes with phrases such as save a life, save a lung, and save a boob. You know, clearly this is an absolutely unregulated Wild West of teen-targeted advertising. The industry leaders are shameless in their lies to the United States Congress about the genuine intention of their marketing. I am very grateful to Congresswoman Speier for her bill, which would go a long way to rein in the excesses. We'll leave these posters for you to look at after. Our website, tobacco.stanford.edu, has over 5,500 electronic cigarette advertisements. And if you need imagery for your stories, we're very happy to provide digital copies. Thank you.
Watch the robot ad, which is up on YouTube, and it should be X-rated on YouTube. It really goes above and beyond. We're next going to hear from Dr. Thomas Aragon. Dr. Tomas Aragon is the director of the Population Health Division at the San Francisco Department of Public Health, and he's going to talk to us about smoking as a public health issue. Aragon?
Good morning. Many thanks to Congresswoman Jackie Speier for protecting and promoting the public's health in our district. I am the health officer of the City and County of San Francisco and director of the Public Health Division. I am your community doctor. My job is to protect and promote the health of everyone in San Francisco, but especially our most vulnerable. I live in the city with my wife, who is a first grade teacher for the public schools. We are raising 3 teenagers, ages 13, 16, and 17. We care deeply about the health of families and keeping San Francisco safe and healthy for families and communities. We are acutely aware of how e-cigarette legislation can directly protect the health of families and communities. As a health officer, my job is to call it as I see it. These facts are indisputable. Number 1, nicotine is addictive. Number 2, the e-cigarette industry is unregulated. E-cigarettes are nicotine delivery devices. And number 3, the e-cigarette industry is targeting our youth, as was just shown. Regulating e-cigarettes is good public health. Regulating e-cigarettes will strengthen our public health protections against promoting nicotine addiction and smoking. Regulating e-cigarettes will strengthen our social norms against smoking cigarettes of any type. Regulating e-cigarettes will prevent increased recruitment of our youth into lifelong nicotine addiction. What is the real issue here? The real issue here is a promotion of nicotine addiction, plain and simple. Recently, I spoke to my daughter's 7th grade class about the dangers of smoking and e-cigarettes. I searched for a metaphor to capture their imagination. In this case, it was easy. Zombies, The Walking Dead. Picture this. Zombies are the tobacco industry invading our homes to bite us. We fight back by fortifying our homes with legislation to protect us. But now, The Walking Dead have a new script. They're now body snatchers, appearing normal on the outside, but nonetheless, nicotine zombies on the inside. They are wolves in sheep's clothing, and they want us to trust them and to let them into our homes, into our communities, and into our bodies. They want to lure us and new generations into lifelong nicotine addiction. I'm your community doctor. Don't buy it, don't buy it, don't buy it. We support Jackie Speier, and we support the Smoke Act. Thank you.
We're delighted to be here at San Francisco General. We have others from the hospital system that are here that I'd like to just introduce. Chief Nursing Officer Terry D'Antoni. Derek Smith, the San Francisco Department of Health Tobacco-Free Project Leader. Arla Escontrias and Anson Moon, both here at the hospital as well. Next, we're going to hear from Dr. Neil Benowitz, who is the Professor of Medicine and Bioengineering at UCSF and the Associate Medical Director at San Francisco's Division of the California Poison Control System. Please welcome him.
I'm here on behalf of the poison control systems to support the idea that e-cigarettes represent a serious acute toxicity threat to children, and that there needs to be child-proof packaging for e-cigarettes. Nicotine is not in tobacco as an accident. Nicotine is there because it protects the tobacco plant. It's a potent insecticide. Black leaf 40, which many of you may use to spray on your roses to kill aphids, is a nicotine sulfate solution. Small amounts, smokers get a stimulant effect from nicotine, but in larger amounts, it poisons the nervous system. over many years there have been numerous people who have gotten sick and have even died from exposure to nicotine pesticides. E-cigarettes presents a new challenge. Some facts about nicotine. The smoker takes in about 1 milligram and thousands of a gram of nicotine in a cigarette. An experienced e-cigarette user takes in about the same. The amount of nicotine in a regular cigarette is about 10 milligrams. If a child takes that, they get sick. E-cigarettes, you can see here, have got a liquid, concentrated nicotine solution inside the cigarette. About 5 milliliters, say an average of 20 milligrams per mil, is 100 milligrams. So in one e-cigarette, there is 10 times as much nicotine as in a regular cigarette. If a child were to consume 1 teaspoon of the solution, it would be far above what we consider to be the lethal range. These are refill bottles containing 30 milliliters. These contain 600 milligrams of nicotine. This is enough to kill half of a first grade class. The Poison Control Center, the poison control centers around the country have seen escalating numbers of calls about possible poisonings in the past few years. 2,500 calls nationally in the past 3 years. The California Poison Control Center had 2 to 3 calls per month in 2012. We're now getting 12 calls per month about possible poisonings from e-cigarettes. So far, we've been lucky. There have been no deaths in children. There have been numerous cases of kids getting sick. 40% of the children exposed end up being referred to the emergency rooms. Not in the U.S., but in Europe, several children have died from ingestion of e-cigarettes. So the poison control system feels very strongly that Congresswoman Speier's proposed legislation, child-proofing of e-cigarettes and the cartridges and refill products is a very high public health priority. Thank you very much.
Let me just underscore the fact that these are easily opened by youngsters. And the fact that they're not childproof and that, as the doctor says, this can kill half of a classroom of kids should be alarming to all of us. Finally, we're going to hear from a young person who's actually done some studying on this issue. Her name is Elle Nguyen. She's 17. She's a member of the Vietnamese Youth Development Center, and she has just graduated from Mission High School and will be attending UC Santa Cruz in computer science this summer. Please welcome Elle.
Some of my team members who go to SF State, whose campus has a smoke-free policy, have seen young classmates using e-cigarettes in public places